In this video, I'm going to show you an effective way to stretch the forearm flexors as well as the extensors. Stay tuned. If you're familiar with the terms carpal tunnel syndrome or medial epicondylitis or forearm pain or tightness or something like that, sometimes when we approach a forearm flexor stretch, that's probably a good way to start your journey when you have some issues that might sound like this. The way that we're going to go about doing this is understanding the anatomy. Most of these muscles will start on the inside of the elbow, they're going to cross the wrist, and some of them will go down to the fingertips. So the best way that I show my patients to do this stretch is pulling back on the fingertips and extending the elbow. And when we do the stretch, we're going to hold it for 10 to 15 seconds. They're small muscles, and we're going to do this probably once an hour because there's got to be things you're doing throughout the day that's making it worse. So it makes sense to do these throughout the day so you can help make them better. I can't say that you're going to do this stretch wrong in the regard that if you don't do it the way that I show you, you're going to injure anything. You're just probably not going to do it as effective as I show you extending the fingertips and extending the elbow. Some of my patients will have their fingers pointed straight up and they're going to pull back there. Sometimes they'll also extend the elbow. Yeah, absolutely, you can feel some stretch here, but the whole point is that we want to try to elongate these muscles where they start and where they end to get the most effective stretch, which is why we're always going to supinate, pull back on the fingertips, and extend the elbow to stretch these flexor muscles. If we want to consider stretching the extensor muscles of the forearm, let's say that you've read about medial epicondylitis or some issues with grip strength or something like that, this is probably an area that we want to focus on stretching, at least to begin with. With these muscles here, this is probably the most difficult stretch that I ever show any of my patients, and it's just because of the orientation of it. So we're going to kind of go through this. Let's say we want to stretch this right side. So what I'm going to do is I'm going to extend my elbow. I'm going to turn where my thumb is straight down. I'm going to push my wrist out like this. And then I'm going to take my free hand, always and forever, I'm going over the top of the other arm. I'm going to intertwine my fingertips and I'm going to pull back even more. When we do that, we're going to feel a really good stretch all within this area here. And that about does it for the forearm stretches, both for the flexors as well as the extensors. Keep in mind that these are small muscles that we're trying to stretch, so please practice these at home. I usually tell my patients 10 to 15 seconds per stretch, stretch them throughout the day because there's gotta be things that you do during the day that seem to continually aggravate these muscles, whether it's opening up a car door, grabbing a jug of milk out of the refrigerator, a lot of these little things that complicate this throughout the day. So thank you for watching. Stick around, I have plenty of other videos for you to watch, and we'll see you guys on the other side.